The month of September is all about men taking charge and being more aware of their own health, specifically their prostate health. The fact is their chances of being diagnosed with prostate cancer are about the same for women and breast cancer. So let's stop ignoring the symptoms or maybe putting off the screenings. Here to help us today, Doctor Ronney Abaza, urologist who specializes in prostate cancer at Mount Carmel. Good to meet you and have you on with me.
Thanks for having me, Robin.
All right, let's talk about why it is, first of all, so important to raise awareness. When we talk about prostate cancer, just talking about it is probably very helpful, right?
Yeah, absolutely. So prostate cancer is one of the most common cancers. It's the second most common cancer in men, right after skin cancer. And believe it or not, 1 in 8 men will be diagnosed with prostate cancer in their lifetime. So very common cancer, and very important that men get diagnosed in the early stages, because when it's caught early, it's very curable. If you wait too late, it's no longer curable, unfortunately, and can be deadly.
And can be. And we talk a lot when we're talking about cancer of signs and symptoms, things people can look out for. Prostate cancer, kind of a rare situation in that regard.
Yes, absolutely. So prostate cancer, unfortunately, doesn't have symptoms until it's in its late stages. And if you wait until you have symptoms, that's usually because it's spread to other parts of the body, like the bone, for example, which can be very painful. So we don't want to wait until that point. We want to catch the cancer when it's still localized in the prostate, when it's still very curable. And so to do so, that's what makes screening so important.
Okay, so to be proactive, you're saying to get the screening. First of all, I know that there's often ages, right, associated with screenings. Is there a certain age that starts? Who maybe needs to look into getting that at an earlier age?
Absolutely. So prostate cancer, one of the biggest risk factors for prostate cancer is age. And so the majority of men diagnosed with prostate cancer will be age 65 and above. But that doesn't let everybody else off the hook, because believe it or not, I've operated on men in their 30s and 40s with prostate cancer. So prostate cancer can happen much earlier, and men who are at higher risk are men with a family history of prostate cancer. Race is a risk factor for prostate cancer, with African American men having a higher risk. So men need to start getting screened in their 50s, so at age 50 and above, or if they have a risk factor like family history or African American race, they should start in their 40s.
Okay.
So we recommend men, when they hit 40, get their first prostate cancer screening done, and then depending on their risk factors, they may not have to do it every year, so they may be able to do it every other year or every few years. But eventually, when you get to age 50, everybody should be getting it once a year.
Okay, so let's let people know what that screening looks like then. What is involved?
So just like any other screening, there's different ways that a man can be screened for prostate cancer, the simplest of which is just a blood test. So just getting a blood test once a year, easiest thing to do. But just like women with breast cancer, as you know, Robin, you know, if you have a lump, that's risk for cancer. So the same thing with prostate cancer. We do a finger test, you know, through the bottom to check for lumps. A lot of men hate that idea, don't want to do it. And unfortunately, many men get scared away, and so they don't do prostate cancer screening simply because they don't want to have that test. But at the very least, they can do the blood test, which will catch the vast majority of prostate cancers. So what we tell men is, don't throw the baby out with the bathwater. Even if you don't want to have the finger test, then at least get the blood test, and you can do that once a year and at least be able to catch most of those cancers. I'll
tell you, any test is better than actually going through and not having the education and getting it done early and finding out if something is wrong at an earlier stage. So, I mean,
and that's the key. That's the critical part of prostate cancer, is because it doesn't have any early signs and symptoms. You can't wait until you have symptoms, because then it's usually too late. So you have to do the screening. You have to catch it early, because if we do, it's more than 90% curable.
And so how is it treated? What are some of the ways that you're going to be able to help men in the early stages, and even if there is surgery or something more invasive involved?
So believe it or not, a lot of men won't need treatment at all. So there are slow-growing, less aggressive, more indolent prostate cancers that can just be monitored, what we call active surveillance. And so those men, will keep an eye on them, especially if they're elderly, if they have a lot of other medical problems and the cancer is unlikely to cause a problem for them. Then we'll just keep an eye on them and monitor them, make sure that the cancer is not progressing. For those men who have more serious cancers and need to have treatment, the two standard treatments are either surgery or radiation. And again, both of those, when the cancer is caught early, have more than a 90% cure rate.
And so I think that too is, you put that out there. A lot of the times this is so treatable. A lot of the times you don't even have to do anything to treat it. Maybe men would be more apt to go screen and then not say, hey, I'm nervous about that aspect, right? I don't want to find it out. Because a lot of times this is a very easy thing to deal with, but you don't want to wait, right?
Yes, and the treatments have gotten so much better. That's the other side of this, is that a lot of men don't want to know if they have prostate cancer because they're afraid of the treatment and the side effects of treatment. But those have gotten so much better that the vast majority of men are curable and will get back to normal life and normal lifestyle after treatment and after cure.
All right, so leaving our viewers with that, it is pay attention to it, right? Recognize your health, go get screened, and of course, if there's any signs, symptoms, go see your doctor. Always
Absolutely.
better.
And especially for those people who have men in their lives that they love, you know how men are. They don't want to go see doctors, they don't want to get screened, but it's so important that they do. So if you have a man in your life that you love, make sure that they go and get tested and get checked for prostate cancer.
Perfect. There you go, doctor. It has been a pleasure. Mount Carmel, the website down there. If you are looking for a doctor as well, you can get connected with an expert. So thank you.
Thank you, Robin.